dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. My name is Yvonne Dunitz, and our topic today is about human papillomavirus infection, what it is, what cancers are caused by it, and how common the infections are, and how does HPV affect men as well as women, and the protections that can be taken for our children. My guests are Jessica Gorin. She's a master's in public health who develops and manages programs for the National Division of Public Health and Community Services. She has been working in the healthcare industry for over 20 years. Increasing HPV vaccination rates is her new mission in meeting her grant objectives. And Marlena Duarte Canela, an intern at National Division of Public Health and Community Services, who is a senior at Franklin Pierce University studying health sciences. She aspires to be a nurse practitioner or physician's assistant. She is very interested in endocrinology, pathology, autoimmune diseases, and pediatrics. Welcome. It's so nice to have you here, and it's so wonderful to be able to have an intern that is working with you to join us. And it'd be great to let us know what your objectives are as far as what role you'll be playing in the public health department.
Yes, it's been really nice to have Marlene with us to help us with our HPV campaign. Mm-hmm. And Marlene can tell you a little bit about her objectives as an intern with our campaign.
So I am working on creating a strategic plan to help increase the HPV vaccination rate by 5% in 1 year here in New Hampshire. And we're creating an HPV campaign to do vaccination clinics in middle schools. And this will be occurring by the time school begins.
And this year, September of 2017. So
if all goes well.
If all goes well. So let's talk about what is HPV.
So HPV is a human papillomavirus. It is the virus that causes warts, and it also is responsible for some cancers. The virus is a mucosal infection, but can also be spread by contact. So if you have common warts on your hands, that's also HPV, and that can, if somebody has a wart on their hand and they shake your hand, then you can transfer it that way. But in HPV, as most people know it, it's the mucosal infection. And
mucosal meaning?
So any mucous membranes, it's transferred from mucous membranes.
And how can that be transferred?
Sexual intercourse is one way that it is transferred, and that's the way that most people know of it. But it can be contracted orally. It can also be contracted through other mucous membranes.
And through orally, would that be based upon from drinking from a glass or anything of that sort, or is that from sexual relations?
Sexual relations.
Okay, it's important to distinguish that for
exactly.
people, just so that they understand it.
Exactly.
So how common is the HPV infection?
Although I do want to clarify, there have been cases where there's been no sexual intercourse, and yet somebody still has contracted the virus.
Okay.
So, and how common is it? Currently, 79 million people in the United States have HPV.
Really? And how is it treated?
There is no treatment for HPV. So the real treatment for HPV is prevention. And prevention comes through the HPV vaccination.
Okay, and what ages?
Usually it occurs between teenagers and among people in their teen years.
So sexually active young people?
Yes.
Up to 20 years old, I believe,
yes.
is the most common.
And is it most common in girls and boys, or both?
It is actually common in both sexes. Between both sexes, females are usually most likely to get cervical cancer, and men are more likely to get oropharyngeal cancer, whereas both of them are also have the same risk of getting anal cancer.
I see. And so from a prevention point of view, what can people do to prevent getting this?
So to prevent getting this virus, the best way to prevent it is by vaccination. Vaccination helps decrease the amount of cancers that can occur with the virus, and cancers do occur if there's any cell changes, although many people can do tests, such as women who get the pap smear exam, and of course for sexually transmitted infections, there are condoms out there that you can use or just remain sexual free.
What would be the signs that people and symptoms that people can be aware of to look for if, in fact, how quickly from the time you may have sexual relations that you might actually see a symptom of this occurring?
Some people never have symptoms of HPV. Symptoms of HPV can be genital warts, and those you would notice on the outside of your genitalia.
And what would they look like?
They can be small and look like a common wart that you would find on your hand, and then over time they can grow, and they kind of have a cauliflower type of head on them.
Okay.
So those are the genital warts, and then the other symptoms of HPV are cancers. Those cancers are found and discovered through cancer screening. So as Marlene was talking about, she was saying that regular pap smears are usually when we'll notice an abnormal cell structure. And with those abnormal cell growth on the cervix, they can then diagnose HPV. So that cervical cancer is then what is treated. So the HPV stays with the person for the rest of their life, but the cervical cancer can then be treated. And that's why regular pap smears are so important, because those are the ones that catch those cancers. The oral cancers are caught through regular visits to your dentist.
To your dentist, so the dentist would be the one that would catch that.
Absolutely.
So at what age should the shots be taken, and how many doses would it be? And who would be providing it? The primary care provider, the pediatrician, a GYN?
So although children are required or recommended to get this vaccination by the ages of 11 and 12 years old, it is also recommended that they can start by the age of 9 years old. And this is because the series will be completed by the age of 13 years old, only because of the dosages that are required between the intervals. So say that they did get vaccinated by the age of 11 or 12 years old, they would get their second step vaccination, and it would be completed by the age of 13 years old.
Now, of course, parents are more concerned now related to, different injections or why they should do it or not. If a parent believed that their child was going to be in the mode of prevention and not be sexually active, would they not want to have the child get this, or is this for anyone to have it?
This is for both males and females to receive the vaccination, and the reason it's recommended is to have it done before children are sexually active, so that they are protected against the HPV vaccine or HPV virus when they do become sexually active. They will already be protected, because in this day and age, you just don't know when your children will become sexually active. So getting it before that time where there really is a chance for them to be sexually active is the best time for prevention.
And does that prevent them through the rest of their life?
Yes.
And how many dosages do they need?
So if the child gets the vaccine before they're 15 years old, they will receive 2 doses. And the doses are spread out by 6 months. So they come in and they get their first dose, say at 11 years old, when they're getting their other adolescent vaccines, their Tdap for tetanus, diphtheria, and pertussis. And they'll also get their meningitis vaccination at the same time. So then 6 months later, they would have to come in and have a second dose. Once they start the vaccine, they do not have to restart. So if they miss that 6-month period and it's a year later, they can still receive the second dose, and it will protect them further.
And If they didn't get it during that time period, and let's say they begin to get it before they go off to college or a little in the later years, will that still help them and prevent anything? Or
Absolutely, because there's multiple strains of HPV. So coming in and getting it even after you're sexually active can still protect you. And then the recommendation by the CDC is up to 26 years old, they can receive the vaccination. But however, if they get the vaccination after the age of 15, they will have to do a 3-dose series. So the first dose they will get, and then 1 to 2 months after the first dose, they receive the second dose. And 6 months after the second dose, they should receive the third dose.
and is it an injection that goes into the arm?
Yes.
And what are the symptoms that may arise after having the shot? Any reactions to it?
There are some reactions, but very minor. Some have reported to feel syncope, otherwise known as fainting. Some have reported to have nausea, headaches, and blurry vision. But it's either a 1 to 10 for a headache and very slight for a syncope.
Any contraindications for this particular shot series?
The only contraindications that I'm aware of is anybody that's immunocompromised,
Which means?
which means if somebody has an immune deficiency, so something like HIV, or some children just are immunocompromised, so they are not allowed to have vaccinations.
And so then how are they protected?
They are protected because other people are getting the vaccine, and it's called herd immunizations. And so it means that if majority of people are vaccinated, you're least likely to spread that disease because less people have it.
And so what has been the success rate for having these vaccinations?
So the success rates for these vaccinations are, they did a study, they looked at the data before they started the HPV vaccination and looked at the rates of HPV. Then they looked at it 4 years after they started the immunization campaign for HPV, and they had decreased HPV rates by 56% in ages 14 to 20.
Very good. And what are the goals that you have in mind to be able to achieve again? You were saying you wanted to see the percentage. How many people are you trying to reach to, and how will you let people know about this, and how can they get these shots?
Okay. Through our campaign, one of our major things is to try and get providers and doctors to give stronger recommendations to parents. And by this, we are handing out kits which help providers tell parents what the symptoms are and what would be the reasons why they should vaccinate their children, the importance of HPV vaccinations for cancer prevention and all. And we believe that if providers give a stronger recommendation to parents, parents will be more stronger and like to vaccinate their children against HPV.
And so there's a campaign to reach out to the medical community and all the primary care providers then through the health department to help them to be aware of the important role that they take in helping this to happen?
Yes, so included in that provider package or that provider kit are posters for their offices.
Wonderful.
that are directed towards the parents that say, if there was a vaccine to prevent cancer, wouldn't you get that for me? And it's a child on the poster. So it's really having the child advocate for themselves to mom and dad, saying, Mom and Dad, please immunize me against this cancers. The other thing is we will have immunization schedules in the provider packets, and there'll be a tip sheet that the providers will have they can continue to reuse. And it gives the providers an idea of what to say to a parent when a parent says, my child's not sexually active. Right. And then the provider would be able to say, well, we talked about this earlier in our conversation. The provider would be able to talk to the parent and say, this is because it's preventative and you want to have your child have this vaccine before they're sexually active. And not all HPV is sexually transmitted. So it's important for them to understand that. The parents might have questions about safety concerns or side effects, and the providers could then talk about the safety of the HPV vaccine, and that is constantly being looked at by the Centers for Disease Control. They're always going over vaccine safety And if anything shows up, like the same side effect over and over and over again, then they take a look at the safety of that vaccine and or may change the recommendation for that vaccine. So the only vaccines that are out on the market are the ones that have been proven to be safe and effective. But giving that information to the providers for them to then pass on to the parents is very important.
So this vaccination is given separately from any of the vaccinations that students need before they enter school.
It is given to, it is offered along with the required vaccination of Tdap, so the tetanus, diphtheria, pertussis vaccine.
Which is given how often?
That is given, I believe, during infancy, but I'm not 100%. But then there's a booster done again when they're 11 years old. And that's the adolescent vaccine.
Mm-hmm. And is the recommendation that this particular vaccination happen at the same time of that, or to be separated out so that there wouldn't be any symptoms that may cause parents to be concerned of too many things going into the bodies of their children at the same time?
It's recommended safe to give at the same time.
Okay. Did you have a thought to add there?
Yes, we are trying to recommend the HPV shot to be given at the same time as the Tdap and meningitis shot, only because this will allow parents to want to give all 3 shots at the same time, and it aids in the strong recommendation part for the providers. We don't only want the providers to give a strong recommendation, but we also want parents to understand the importance of this vaccine. So if we recommend all vaccines to be given at the same time, we would have a higher percentage of vaccination for the HPV vaccine.
And as a mom, myself, of 3 teenagers, trying to get my children back to the provider's office, taking time off of school, taking time off of work, that's really hard to do. If they're already in the provider's office and they're already getting their recommended vaccinations, it's so much more convenient and important that they're getting this preventative vaccine that prevents cancer.
Okay. So the most important things that you would recommend and say to parents who may have concern about giving this vaccination to their children at, you said, as early as age 9 or 10, what would you tell them?
Okay. I want to say that this vaccine is mainly for cancer prevention. I'm pretty sure that by saying cancer prevention right away, it gets the parents alerted and they want to prevent their child from getting any type of cancer. It's very safe and it is recommended just for cancer prevention and all. Every year in the U.S., there's 27,000 people that are diagnosed with cancer caused by HPV. So this, by giving the vaccine, it would help reduce the type of cancers that occur in people. And there are many different cancers that are associated between both sexes, such as anal, cervical, oropharyngeal, penile, vaginal, and vulval cancer. So as you can see, all these cancers are among both sexes. This is why we recommend both sexes get vaccinated at such age, because many people stigmatize that it's only a problem for females, but as you can see, it's also a problem for males as well.
And you had mentioned the different types of cancers. Can you explain it again? You were talking about those that can be passed through the hands. Why don't you explain that a little bit further?
Well, the ones that are passed through the hands aren't necessarily cancerous. They're just common warts that most people would see. But you can also associate that those are HPV related as well.
Mm-hmm. And so the common prevention, which would, I'm sure, help related to that is as far as washing and everything else?
And removal. So once you notice that you have a common wart on your hand, you want to go to the doctor.
And a common wart looks like what, in case somebody doesn't know what it looks like?
It's a regular bubble. So a lot of people, it would occur here or even in the back of their foot. Like, it's just a regular, hard, round, bubble-looking thing. You will notice it because it just looks abnormal.
It's skin-colored, hard, circular, raised above the skin.
And so as soon as you were to see that, you're to go to your primary care provider to have that removed.
Correct.
Okay.
And then that would stop the spread of that.
And that will stop the spread of that. Now, the other types of cancer and areas that this can be passed, you were saying was from sexual transmission. So explain that a little more so people understand that and how easily that this can, in fact, impact their lives.
So Originally, it was believed that men were only carriers of HPV, and that the real danger was to women with cervical cancer, because women were dying from cervical cancer. They weren't getting their regular pap smears. They weren't getting diagnosed on time, and it would go from a treatable cancer to stage 4, where it was harder to be treated. Over time, we have learned that HPV, is men were not only carrying it, but they were also having cancers related to HPV as well. And we saw that they were getting, men, the majority of them, 70%, 77% of the cancers caused by HPV in men are oropharyngeal.
Really?
So that is a huge number of cancers for men caused by having oral cancer. And that's from sexual relations.
Absolutely.
And then penile cancer, anal cancer in men who are having sex with men. That is another way that HPV is spread, and the cancer that it causes. So for women, it also is oropharyngeal. And then, but the majority of women, 59%, is cervical cancer. And that is treated fairly easily as long as you have regular pap smears. You can have a treatment where they freeze the cells on the cervix. It's uncomfortable and painful, but it is what they do to remove the abnormal cervical cells.
And once that's done, is it finished or no?
You always have to go back for regular screenings, and even more often than you would before.
Okay.
So,
if we were to summarize the most important things you would want to tell parents and the physicians and primary care providers about the ways that you can work collectively together related to that herd response
yes,
that you were saying, as far as to try to immunize for the sake of what?
You want to immunize for the sake of prevention.
Okay, so for the sake of prevention, what would you say to parents on why it's so important that they get this vaccination for their children?
Parents have the opportunity to prevent their children from having cancer. If, as a parent myself, I want to protect my children, and I want to prevent them from having cancer. And that's the most important reason. You can't be with your children 24/7, and I know that as a mom of 3 teenagers, they're off doing their own thing. I have to trust them. I have to trust what they're telling me they're doing. But I also was a teenager, and I didn't tell my parents everything. So having that vaccination gives you peace of mind that you're protecting your children from the potential of having multiple cancers.
From sexually transmitted?
From sexually transmitted.
And from a primary care provider's perspective, of the important role that they play in helping to get this information out to parents and to take care of their children, what would you say to them?
I would say to tell them that it's just for cancer prevention as well. It's really important, and like she had mentioned, we don't all know what our kids are doing out there, but if you really want to keep your child safe and not have any harm from any possible cell changes, to vaccinate.
And the vaccinations go directly to the primary care providers' offices. Where can people get them?
People can get vaccinations at their primary care providers' offices. That is the recommendation. However, we also have them at the community health clinic on 18 Mulberry Street in Nashua. People can come in on Tuesdays from 4 to 7, and from Fridays from 8:30 in the morning until 10:30 in the morning. We have immunization clinics. For $10, people can come in and get all of their immunizations. We never turn anybody away for lack of being able to pay. So if somebody has problems and they cannot afford the $10, we will still vaccinate them.
And this would be the same in any health department throughout the United States, that they would also be providing clinics like this, as well as primary care providers throughout the United States. The recommendation would be that they would be educating their parents and their children on the necessity for prevention of this shot.
That's the recommendation by the CDC, is to improve recommendations from providers. That is the number one way that increasing the vaccination is happening is by provider recommendation. The other thing that our department is doing and that has been proven scientifically successful in other locations is school-based clinics.
Tell us about that.
And one of the things that Marlene will be working with me on is we're developing school-based clinics, working with the schools in doing clinics in-house. So during the school day, we will be there providing immunizations. The children will be able to come, students will be able to come down, get their vaccinations for Tdap, meningococcal, flu vaccine, and HPV. The flu vaccine is a separate clinic that we do all on its own, but they'll be able to get those 3 adolescent vaccinations right at school. Won't have to miss any time from school to get the shot. Parents won't have to miss work.
And will you have a parent permission slip that will be signed that the student will bring in order to receive it?
Absolutely.
Any other information that the student needs to bring into school?
Their immunization records.
Okay, and how will you be notifying the parents that this program will be coming directly into the schools for convenience to help them to get these shots of their children?
So we are still in the process of, we have a new superintendent who we have not met yet. I believe Bobby has met our new superintendent, but we have not met.
Bobby Bagley is the Director of Public Health.
Public Health, yes. So once we have a meeting with them, we will be talking a little bit more about the importance of these clinics and scheduling them and making sure that we get a proper approval to have them go on. But the idea behind them is to have the school-based clinic with parental permission, with immunization records, and be able to go in and have the vaccinations done and then follow up in 6 more months to have the second series of HPV done.
And will there be a cost to the students?
It'll be free.
It will be free.
It'll be free for the greater Nashua Public Health Region, which includes Nashua, but also the 13 surrounding towns.
Okay, and that would include public and private schools?
Right now, our focus is public schools, but if private schools are interested, they're welcome to contact us at the Public Health Department.
And at what number would they call?
At 589-4513.
And if anybody had any questions, they could also call that number.
They could call that number and that would reach me directly.
Excellent. Excellent. This is a very important program and an important awareness that you're giving people to help them really prevent a very important disease. We thank you very much for all that you're doing. Until next time.